Hello, I'm Allie Lewis. I'm a family nurse practitioner student at the University of Memphis doing my head-to-toe assessment for spring 2026. Today is January 23rd. I'll be doing it in the kitchen. Here is the floor, my lovely mother for my patient, the walls, the ceiling, countertops, floor, ceiling, rooms, and let's see. So, throughout this assessment, I'm going to be looking at her skin. I'm going to be noting the color, temperature, texture, moisture. I'm looking for edema. I'm looking for any lesions, scars, bruising, and nevi. I'm looking, starting off with her head and her neck. I'm looking and noting her hair color, her hair distribution, and texture. And I'm going to feel for any lesions, masses, depressions. Look for any infestations, any growths or abnormalities, which none are noted. Moving into the next portion of the exam, I'm going to be palpating your temporal arteries for any tenderness. And then I'm going to feel for your lymph nodes, so your pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical chain, posterior cervical chain, and supraclaviculars. And then while I'm here, I'm going to check for TMJs, if you could open your jaw. And there's no popping or crepitus noted. And then I'm going to test for cranial nerve 5, so if you could clench your jaw. Perfect. And then the second part of cranial nerve 5 is light sensations. So if you could close your eyes and tell me where I touch.
Forehead, left cheek, right cheek, nose, chin.
Chin, perfect. And then the next part is cranial nerve 7. So if you could smile, frown, pucker your lips, puff out your cheeks, and raise your eyebrows. Perfect. Now we're going to move on to ears. So I'm going to first palpate for any masses on the pinea and tragus and any tenderness, and then I'm going to look into the ear canal, looking for any blockages, and also looking at the tympanic membrane and noting that it's pearly gray and translucent. And I'm going to do the same exact thing on this side, looking for any blockages and noting a pearly gray translucent tympanic membrane. And now we're going to do cranial nerve 8. So we're going to do some hearing tests. So if you could cover your right ear and tell me what I say.
1, 2, 3.
Perfect. And the other side?
ABC.
Perfect. Now we're going to do the Weber test for lateralization. So if you could tell me if you hear this in both ears.
Yes.
Perfect. And then we're going to do the Ryan test.
Yes.
Over it's behind on your mastoid bone.
Yes.
And when do you stop hearing it?
Now.
Perfect. And the same on this side.
Now.
And this side.
Now.
Perfect. And air conduction is greater than bone conduction. Now we're ready to move on to eyes. So we'll start off. When I'm looking at her eyes, I'm looking at the lashes, the eyebrows, I'm looking at her palpebral fissures. I'm checking the sclera color, making sure that it's white, and the conjunctiva, making sure that it's pink and moist. And we're going to test cranial nerve 2 for visual acuity. So if you could read the lowest line that you can.
DEFPOTEL.
And then will you cover each eye and do it again?
DEFPOTEL.
Perfect.
DEFPOTEL.
Perfect. And then now I'm going to test for cranial nerves 3, 4, and 6 for EOM. So if you could follow my fingers. Perfect. And then I'm going to test for pupillary constriction, direct and consensually. So while I'm looking directly at this eye, it is noting perla. I'm also looking at her other eye to make sure that it is doing the same thing consensually. And again on the opposite side, noting parallel, direct, and consensual. And then I'm testing for accommodation and convergence. So if you could, look at my finger, follow it inward, and then look past my finger. Perfect. And I think that is it for eyes. We're ready to move on to nose. So when I'm assessing her nose and making sure that it is midline and straight, I'm going to test for patency. So if you could close your right nostril and breathe in, and then your left nostril and breathe in. Perfect. And then we're going to do cranial nerve 1. So close your eyes and tell me what you smell.
Alcohol.
Perfect. And then we're moving on from, oh no we're not, we're doing, you can open your eyes. I'm just going to palpate your frontal and maxillary sinuses for any tenderness. That noted, and then we just did nose, eyes, ears. So we're going to do mouth and throat. While I'm looking and inspecting her mouth, I'm looking at her lips, teeth, tongues, buccal mucosa, posterior pharynx, the floor of the mouth, and the tonsils. So if you could open your mouth, I'm going to grade your tonsils. They're grade 1. And then if you could, for cranial nerve 9 and 10, say ah.
Ah.
And that is uvula and soft palate rise with phonation. And then cranial nerve 12, if you could stick out your tongue. And I'm noting that it is midline with no fasciculations. And I think we're ready to move on to throat and neck. So if you could, I'm just going to palpate for the trachea, noting that it is midline. And if you could look up again, and we'll test for your thyroid, so you could swallow while I displace. Perfect. And again on this side. Perfect. And on here, I'm going to palpate for the carotid arteries, noting that there are 2+. I don't know if I'm blocking them, I don't think so. And then I'm going to listen with the bell of my stethoscope for any carotid breweries, which I don't know any. And I think we're ready to move on to respiratory. So looking at the respiratory assessment, I'm noting for any signs and symptoms of respiratory distress, any posturing, tracheal tugging, any tachypnea, discoloration like cyanosis. I'm looking for symmetry while she's breathing, and I'm not noting any front or the back. I'm also looking for any deformities. There we go. Okay, so I'm ready for you to turn around. And starting off, I'm going to ask you, I'm looking at, it looks symmetrical, but I'm going to ask you to take a deep breath and feel symmetrical. And then now that I'm back here, I'm going to test for tactile firmness. So if you could, each time I move my finger, say 99.
99, 99, 99, 99, 99.
And now I'm going to percuss for resonance in all lung fields. And then now I'm just going to listen with the diaphragm of my stethoscope for breath sounds. For time purposes, we're just going to go through the motions. So breathe in and out, 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 and out. And then the laterals and bases. And then we're going to do echophony, bronchophony, and whisper pectoraliquy. So if you could, each time I move my stethoscope, say E.
E, 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 E.
And now for bronchophony, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
And for whisper pectoraliquy, whisper 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Perfect. And we're ready to do inferior chest, so if you could turn back around for me. And I'm again going to note for signs of deformities or signs of respiratory distress. I'm noting symmetry while she's breathing. If you could take a deep breath. Perfect. And then I'm also going to do tactile firmness on the front. So each time I move my hand, say 99.
99, 99, 99, 99, 99.
Perfect. And then I'm going to listen with my stethoscope as she breathes in and out. Time purposes, we're going to go faster. Breathe in and out, breathe in and out, 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 and in and out. Perfect. Now we're ready to move on to the cardiac portion of this exam. I'm going to go through each area of the heart with my diaphragm and my bell. Yes. So I'm listening to the aorta, the pulmonic, Erb's point, tricuspid, and mitral. And then again with the bell, my stethoscope, same areas, aortic, pulmonic, Erb's point, tricuspid, mitral. And while I'm here, I'm going to palpate for the PMI. And then I'm going to listen to the apical pulse with my diaphragm for 1 full minute, noting a regular rhythm and a rate between 60 and 100. And perfect. I believe we're ready to move on. So you'll lay at 30 degrees technically. And while she's laying down, I'm looking for any signs and symptoms of jugular venous distension and pulsations. I'm noting for any heaves or lifts, which none are noted, and then I'm going to palpate for any thrills over the aorta, the pulmonic, Erb's point, tricuspid, and mitral valve. And then I'm just going to repeat the cardiac exam while she's laying down with the diaphragm over the same chambers of the heart. And again, with the bell, noting any murmurs or bruits, aorta, pulmonic, Erb's, tricuspid, and mitral. And now we are done with the cardiac portion of the exam. Now we're going to move into abdominal. So with the bell of my stethoscope, I'm going to listen for the aorta, the renal, the iliac, and the femorals. And then I'm going to go back and listen to all 4 quadrants of her abdomen, the left lower, left upper, right upper, and right lower, listening for normal active vowel sounds throughout. Now I'm going to percuss for tympani in all 4 quadrants. And then I'm going to lightly palpate for any masses or tenderness. And after light palpation, we're going to move into palpating for your liver. So if you could kind of take a deep breath. I'm going to feel there is no liver enlargement noted. I'm going to do the same on this side. And feel, deeply palpate, and her spleen is non-palpable. If you could sit back up. Thank you, sorry. And we're going to test for CVA tenderness. So we'll turn it a little bit to the side. I'm going to place my hand here. Do you have any tenderness?
No.
Perfect. And CVA tenderness. Now we are ready to move into musculoskeletal. So if you could, I guess, face the camera a little better. And while I'm assessing, I'm over her joints, her shoulders, her elbows, her hands, and her wrists. I'm feeling for any swelling. I'm looking for redness, warmth, any crepitus or nodules or tenderness if you have any. And then while I'm down here, I'm going to check for cap refill, which is less than 3, and her radial pulses, which are a 2+. And then we're going to move into strength. So if you could, with your hands, squeeze my fingers, noting 5 out of 5. And then for biceps, push up against me and push down against me. Triceps for 5 out of 5. And shoulders, if you can push out against me. push up against me. 5 out of 5. And then for cranial nerve 11, if you could shrug your shoulders. Perfect. Now we're going to move into cerebral coordination. So if you could, actually we're going to do this first. Do finger to thumb opposition quickly, and then flip your hands back and forth, and then with your left hand, touch my finger. Again. Same thing on this side. And then we're going to test stereognosis and graphesthesia. So close your eyes for me and hold out your palms and tell me what I place in this palm.
Pencil.
Yes, and this palm?
Pen.
Perfect, that was stereognosis. Now we're going to do graphesthesia. I'm going to draw a number in each hand and tell me which number it is.
1, 3.
Perfect, and we are done with those. Now we're going to, let's see, I'm going to do light sensation, so close your eyes and tell me where I touch.
Arm.
You can feel it with your sweater.
Left arm. Left leg. Right leg. Right foot. Left foot.
Perfect. And now I'm going to test for vibratory sensation. So I'm going to hold, you can look there, sorry. I'm going to hold this over your ulnar bone and tell me if you feel this.
Yes.
And again.
Yes.
Perfect. And then over your medial meatus.
Yes.
And this side.
Yes.
Perfect. And then, let's see, I'm going to do deep tendon reflexes. So I'm going to go over and do your brachioradialis, your biceps, and then your tricep. And then do it again on this side for your brachioradialis, your biceps, your triceps, and your patellar, and Achilles, and Babinski's on the bottom of your foot. And let's see. Now we're going to move into range of motion with your fingers. You're going to flex, extend, hyperextend, abduct from your body, adduct to your body, and thumb to finger opposition again. And then wrists, flex, extend, hyperextend, ulnar deviation, radial deviation, and rotation. And then elbows, flex, extend, hyperextend, and then shoulders, flex, extend, hyperextend, and then we're going to do internal rotation, external rotation, and circumflexion. Remove them. And then, now that we're done with range of motion, we did strength. Now I'm going to move on to your lower extremities. As I'm palpating over the joints, I'm doing the same that I did for up top, feeling for any swelling, crepitus, tenderness, enlargements, anything abnormal. And that is her hips, her knees, her ankles, and her toes. And then now we're going to do Caprifo, which it will be less than 3, and the pedal pulses, which are at 2+. And while we're down here, we're going to do, we'll do strength. So if you could push against my hands and pull up against my hands for 5 out of 5 strength, and pull in against my, yes, and push against me for 5 out of 5 strength for her knees, and then for hips, push out against me and pull in against me for 5 out of 5 strength in the hips. And before you stand, I want you to flex your feet, extend your feet, outward and inward, and rotation. And I think we are ready to stand, hopefully. So while we're standing, we're gonna test for hip mobility. So you'll flex, extend, hyperextend, and then flex, extend, hyperextend, and then we'll abduct away from the body, adduct to the body, internal rotation, external rotation, and then on the other side we'll abduct away from the body, add to the body, internal rotation, external rotation, and then totally forgot to circular, circumduction, and again circumduction on this side. And then for knees, we will flex, extend, hyperextend, and flex, extend, hyperextend. And now we're ready for your back. So if you could turn a little bit and bend over, and I'm gonna look at the curvature of your spine, making sure it's appropriate with no scoliosis noted while I'm palpating. And then we'll do some range of motion for your spine. So for lumbar spine, here, I'll use it at the beginning. We're gonna bend down though. We'll do, you can bend forward for lumbar, for flex, extend, hyperextend, lateral moves, and rotation. And then again for cervical, we'll flex the neck, extend, hyperextend, lateral, ear to shoulder, and then rotation. And then for the next assessment, you'll hold out your arms and close your eyes. And noting for a negative Romberg test, there's no swaying or moving. And then you can open your eyes and move your hands back down. You'll walk forward straight in a straight line. Perfect. And then walk back toward me, heel to toe in a straight line. Perfect. And then for lastly, we will hop on left foot and hop on right foot. And I think we got everything. That concludes our assessment.